Good evening, and thank you all for joining us for our community leader call for this week. This week we'll be focusing on the new hospital agreements that the mayor's on. Thank you, Jason. that the mayor announced. And so we'll go over to the mayor in just a second, but I want to remind everybody, if you have questions for any of our speakers today, including the mayor, you can press 0 now to be entered into our speaker queue, and we will then answer your questions during the Q&A portion. But to get our speaking program started, we'll start with Mayor Bowser. Mayor Bowser, go ahead.
Thank you, Tomas, and I want to thank everybody for dialing in today. We made a brief statement at my earlier press briefing about how the agreements to secure the new hospital at St. Elizabeth ambulatory care and system will be implemented and have the documents go through the council. Similarly, we talked about the district's investment at the Georgia Avenue site of Howard University Hospital and how Howard University intends to build the new hospital and our investment to help make that happen. So I wanted to ask the city administrator to walk through our journey to get here, how we now will proceed, what we expect the timeline to be, and how we are working with the council to get it done. So with that, I'll turn it over to the city administrator.
Thank you, Mayor, and thank you for all of the folks who are on the line for this telephone town hall. In terms of how we got to this point, the district and the mayor established an objective for us to really look at how we can provide equitable and high-quality care, health care to the residents of the district, particularly given really what are the startling health disparities that we see in the district and know are trends, frankly, across the country. And so we set about a process of evaluating what kind of health care system would be best to serve our residents, and then how we could best partner with an operator to bring service delivery to residents. One of our objectives in recognizing things that we do well and things that we do less well in the district is that we wanted to be out of the hospital operations business and be able to have a healthcare delivery system that is operated by a high-quality, financially stable, strong, with a good track record operator to bring those services to the community. And so we talked with all the major health systems in this region about their willingness and desire to partner with us, and then we evaluated against the criteria all of the discussions and proposals that we received, and then are excited to have settled on Universal Health Services as our partner to operate a new hospital on the campus of St. Elizabeth in Southeast. And so where we are today, after a period of negotiations and discussions about the kind of model that we wanted to build and the kind of programs we wanted to deliver, really is to come back with 2 projects that we're recommending to council. One, to support the construction and development of a hospital campus on the grounds of St. Elizabeth to serve primarily the southeast portion of D.C. in wards 7 and 8, and another project that supports Howard University's desire to rebuild the Howard University Hospital so that they really can continue the fantastic work that they have done in not only producing doctors through the medical school, but serving the residents of D.C. In a new, modernized facility on the campus of Howard University. First, just to describe what the projects are, for the hospital on the campus of St. Elizabeth in Southeast, we have proposed a new 136-bed community hospital that has a verified trauma center. And a verified trauma center just means that there can be more services delivered through that emergency room than what a typical emergency room would be provided. And I'm happy to talk more about that in the Q&A. This hospital also would have maternity and newborn delivery services and obstetrics. It would have a level 2 neonatal intensive care unit and mental health services, and we expect the cost of that to be $306 million in that hospital to deliver in the fall of 2024. Also part of this project is a 70,000 square foot ambulatory pavilion that will have a clinic, physician offices, community space, diagnostics, and specialty care and outpatient surgery. The cost of that facility is $69 million, and we expect it to deliver in 2023. There also will be 2 additional urgent care facilities, one each in Ward 7 and in Ward 8. Then we think the cost of that is about $21 million, and we expect those urgent care facilities to be online in the fall of 21 and the spring of calendar year 22. For the Howard project, Howard University is working on a plan to have redevelopment not only on their campus, but again to develop a new modern facility, and they want to build a $650 million hospital with 225 beds, a level 1 trauma center like the existing Howard University Hospital is, and it will remain an academic teaching hospital, and it'll be about 60,000 square feet. The district is supporting this project through a $225 million 20-year tax abatement, which will allow Howard not only to attract private development to their campus, but use that tax abatement as a way to finance the construction of their new hospital. The district has agreed to become a tenant in their redevelopment so that we can serve as an anchor to attract additional development. So we would move a D.C. government agency or agencies to a new building in that redevelopment and anchor it with our lease. And we also are providing $25 million in infrastructure support through our capital improvement program to help with the utilities and public infrastructure required to support a hospital. Lastly, we're investing $26.6 million over 6 years to support what we're calling 5 centers of excellence. These centers will provide care and services tailored to the specific needs of the community and allow the Howard Hospital to continue to play a critical role in addressing long-standing health disparities. Those 5 centers of excellence include work in sickle cell, in women's health, oral health, trauma and violence prevention, and substance use and co-occurring disorders. So that's just a brief overview of the 2 projects that we have proposed to the council. The last thing I will say before I know Kim Russo is on the line, and we'll give her a moment, and I think Wayne Frederick was going to join us as well from Howard University, and then Dr. Bass, who's the Dean of the Medical School at George Washington University. But the last piece I want to talk about is just the timeline for these initiatives. There is legislation currently at the council for them to consider. There will be a hearing scheduled of the Committee on Health and the Committee on Economic Development, a joint hearing on June 30th at 9 a.m. We're seeking council approval before their recess so that in the fall we can come back with the procurement process for the design of the hospital and the ambulatory center such that we can award construction contracts for the hospital that's on the campus of St. Elizabeth in the summer of 2021 so that we can meet the dates of 2023 to open the ambulatory center and 2024 to open the new hospital. The Howard project legislation is also before the council, and Howard's goal is to aggressively put together their redevelopment plan so that not later than 2026 they can be in a new hospital on the campus of Howard University. So that's just a brief overview of those projects. And Tomas, I know that we've got a couple folks on the line. So should we start with Kim Russo just for a minute to just say hello and talk about their participation in this project? Kim.
Good afternoon. Thank you, Mayor Bowser and City Administrator Young, and to the community for joining us this evening to learn more about these important healthcare projects. As City Administrator Young said, my name is Kimberly Russo, and I am the Chief Executive Officer of the George Washington University Hospital and serve as the representative for Universal Health Services this evening. I would like to really thank you all for the opportunity to speak to you about this vital initiative and our desire to improve healthcare access, quality, and equity for the residents throughout the District of Columbia. As you know and have heard, our residents on the east end of the city currently have severely limited options for healthcare within their communities, which has required them to often travel across the district to seek care and has led to disproportionate health issues. This is simply unacceptable, and UHS, along with our partners, including the D.C. government, GW Hospital, GW Medical Faculty Associates, and the GW School of Medicine, are committed to changing this outcome through our partnerships. We strongly believe that all individuals deserve the right to an integrated academic network of high-quality health care that is convenient for access and close to their home. We cannot wait any longer, and the change of the landscape of healthcare is vitally important, especially now. This is why the GW Clinical Enterprise is here today and coordinated in close partnership with our D.C. government, being able to readily elevate the care for the district. All D.C. residents deserve the highest quality care, and we are committed to making this happen through executing on these agreements discussed today. With your support, we can make D.C. a national leader on healthcare, changing and saving the lives of so many. Please join us in making this vision a reality as we embark upon the journey and change of our healthcare environment. Thank you for taking the time to learn more about these vital projects today. Thank you, CA.
Thank you, Ms. Russo. And for all of our callers that are on the line, if you would press 0 if you have a question, that gets you into the queue for our discussion here. Next, I think we have Dr. Bass, who's the Dean of the Medical School at George Washington University. The university and the medical school play a critical part in this partnership for the development of this hospital, and so I want to just give a moment for Dr. Bass to introduce herself and say a few words. Dr. Bass.
Yes, thank you, City Administrator Young. It's great to be on this call with the others. My name is Barbara Bass, and I serve as the Vice President for Health Affairs at George Washington University and Dean of the School of Medicine and Health Sciences, as well as CEO of the GW Medical Faculty Associates, the commonly known GW MFA, the Faculty Practice Group of George Washington University. On behalf of the entire George Washington University, I'm really delighted to be here today. First, I want to thank my partners at GW, including Thomas LeBlanc, the president of George Washington University, for his commitment to fostering advancement of quality health care in the district through support of this initiative, and of our clinical faculty and researchers. And, of course, to Ms. Kim Russo, the CEO of George Washington Hospital, for her consistent efforts in getting us to this point today. To Mayor Bowser, we're very grateful for your leadership and vision to improve health care for all citizens of the District of Columbia and to achieve health equity in this capital city. Thank you for that. Thank you as well to the other leaders who are on this call tonight, City Administrator Rashad Young, Deputy Mayor Wayne Turnage, and Dr. LaQuandra Nesbitt for working hand in hand with us to get to this moment, as well as for our future partnership as we continue down this path to deliver health and wellness services for all of our citizens. And last, I want to mention also Councilman Vincent Gray for his unwavering dedication to the mission of ensuring access to excellent health care for all. GW is a globally recognized research university whose identity has been shaped by our location in Washington, D.C. As the first medical school in the district, serving the city since 1824, we are proud to be a part of the history and the fabric of this unique district in the nation. We are thrilled to be part of this historic opportunity to remedy gaps in our current healthcare delivery system so to better serve the people of D.C. and beyond. Throughout our history, GW has responded to the growing needs of our own community and society at large by researching and developing solutions to local, national, and global problems. This response is particularly relevant today as we live through the COVID-19 pandemic and starkly see the differential impact of COVID-19 on our population based on race, ethnicity, and socioeconomic status. We look forward to working with the district and UHS with the goal of improving health and wellness, improving healthcare access, and critically to achieving health equity for the residents of Ward 7 and Ward 8, and in so doing, the health and wellness of our entire city. So I thank you for including me this evening. I look forward to more great things to come from this important partnership. Be well.
Well, thank you, Dr. Bass. Before I turn it back over to Tomas and the mayor, I want to give an opportunity for Wayne Frederick, the president of Howard University, to say a couple words about their effort and initiative. Dr. Frederick.
Yeah, thanks, Mr. Young. I also want to thank the mayor, Mayor Bowser as well, for her initiative. While we're discussing facilities, I hope that all the listeners would recognize that what the mayor has laid out is really a healthcare plan for the city. And it's not just about the in-hospital care that will be provided, but a lot of what has to happen in the ambulatory setting. And I think these projects will certainly bring better health to the citizens. Howard Hospital, in the former Freedmen's Hospital that was built in 1862, was for the purpose of serving freed slaves moving from the South. And I think in the moment that we're in the nation's capital, it's extremely important that we recognize that the systematic infrastructure that has been broken for some time in terms of serving all of the citizens of our nation equally needs this type of investment. And I think that D.C., under the mayor's guidance, will lead. Prudence dictates that in a circumstance like this, you can't single any one or two people out, but I will flout that prudence because of the work that I think the city administrator and the deputy mayor, Wayne Turnage and Rashad Young, have done to bring this to fruition as well, and we certainly at Howard want to thank them. We have produced more African-American physicians than any other single institution in this country, and we send more African-Americans to medical school than any other single institution. We also house the only dental school and pharmacy school in the city. And this hospital will continue to allow us to train and therefore impact the inequities that exist, not just in D.C., but I think this is also D.C.'s contribution to the entire U.S. population as well. So we're grateful and we stand ready to work with the city as a key partner, and also to work with all the other hospital partners in the city to continue to provide appropriate care for all the citizens of the city. Thank you.
Thank you. We'll now move to the Q&A portion of the program. So again, if you have not been able to get into the question queue yet, press 0 now, and we will begin to start to call on some of our residents who have some questions for our speakers. So we'll go to our first question from Linda in Ward 5. Linda, your line is unmuted.
Hi, my question is, I hear the services that you're providing at the various hospitals, but I didn't hear anywhere you mention about the seniors who will be able to access those services.
Yeah, thank you for that question, Linda. Absolutely, the seniors will be able to access these services. We're having, for the project at St. Elizabeth, a full suite of services from newborn to senior that will be available for residents' medical care needs. And so from the urgent care clinics where you will be able to go for an emergent issue, medical issue, to the outpatient facility for any procedures or clinic visits that are required, and to even the inpatient facility. What we would hope people don't have to have inpatient services, but we know that that's a fact of a reality of what occurs. All of those services will be focused on our seniors. On the Centers of Excellence, one of the things that I'm really excited about with this partnership with Howard is the focus on oral health. And we know that for our seniors, oral health and dental health is a real critical issue. And I think there's a great opportunity with the Center of Excellence focused on oral health to really focus on our senior population and address an issue that has been a long-standing challenge in the district with respect to our seniors and their oral health.
Thank you, City Administrator. We'll go next to Penny Jefferson in Ward 8. Penny, your line is unmuted.
Yes, hi. Good evening, and thank you for taking my question. My question is, the hospitals that are being built in wards, these two wards, are there opportunities for the district government to have jobs? I mean, anywhere from either facility. Are there opportunities for district government jobs? And are they ran by district government, private, or both?
That's a great question. Let me start with the hospital project on the campus of St. Elizabeth. That will generate, we think, from the construction and operations of the hospital, nearly 5,000 jobs for the district. These projects are subject to the district's CBE, Certified Business Enterprise requirements, and our first source requirements, which means that there has to be a focus and a percentage of those jobs that are available for district residents, both in the construction of the new hospital and the facilities, as well as the operations of the hospital. Additionally, our agreements with Universal Health Services require that there be workforce development programs and initiatives to do a couple of things. One, make sure that district residents who are interested in pursuing health careers have the opportunities to do that, but further, producing a pipeline for current and future employment opportunities at the hospital. So we do think and expect, and the agreements reflect the requirement to have district residents have opportunities for jobs in the hospital. As to how the hospitals are managed, for the hospital in Southeast, the agreement has the district owning the facility and leasing that facility to the operator, and then the operator will run and manage all of the medical services and clinical services and operations of the hospital. So the district will not be running the hospital. Universal Health Services will be running the hospital as they currently, through a partnership with George Washington University, run GW Hospital, located in Foggy Bottom in the northwest portion of the city. Howard's Hospital will be owned and operated by Howard University as it is today.
Thank you, City Administrator. Teresa, your line is unmuted.
Teresa Smith, Ward 8. Greetings, Mayor Bowser and distinguished guests. I have a twofold question. First, I understand the trauma center or unit in the St. Elizabeth campus will not be a level 1 or level 2. And second, I wanted to know how and what kind of checks and balances will be developed by the D.C. government and George Washington University to help supervise Universal Health Services to assure the checks and balances and the balanced budgets so that our D.C. funding taxes will be used in a frugal type way.
I really appreciate those questions. Those are great questions. Let's first start with the trauma question. This hospital is going to be a level 3 trauma center or a level 3 community hospital, which is most comparable to Sibley Memorial that exists in the district today. There's one important difference to this community hospital from what is currently at Sibley, and that is the verified trauma center. So because we're having a verified trauma center, and what that means is that this hospital will have a dedicated trauma director and program manager. There will be 24/7 general surgery availability, 24/7 orthopedic and neurosurgery availability, as well as a dedicated orthopedic surgeon. Because this is a verified trauma center, we have looked at all of the trauma cases that have occurred in the district and in Ward 7 and 8 in particular over the last 2-year period. We know that 9 out of every 10 trauma cases that occur will be able to be treated and managed at this hospital. So 90% of the trauma and emergency cases that have occurred in the district and we expect to occur will be treated at this hospital because we are having a verified trauma center. So we feel very confident that there will be the right service provision that will occur there. Your second part of the question was around checks and balances. We have an extensive set of agreements that are before the council now that governs the operations of the hospital, the role of the district in laying out those expectations, and the obligations of universal health services in meeting those requirements. So there are checks and balances around quality and how we evaluate quality and metrics that ensure that the service delivery is of a high quality. There are metrics around investments and UHS's obligation to invest in the physical plant, the physical hospital after we build it, as well as the community benefits that we've negotiated. And there are provisions for us to discuss the service lines, and so that before any change to a major service line, the district is consulted and our input is solicited before any of those changes occur. So we feel like through the agreements that we have both in the lease of the facility and the operations agreement that we have the kinds of checks and balances that we need to make sure that the taxpayer's investment is protected and that those resources that we use to construct the facility are done efficiently.
Great. We'll go next to Wanda Johnson in Ward 8. Wanda, your line is unmuted.
Hello, Mayor Bowser and staff. My name is Wanda, and I live in Ward 8. And my question is, will the residents of D.C. have the option of having an attending doctor at the location and the facility in the hospitals?
Yeah, we'll go to Kim Russo for that question. Kim, go ahead.
Yes, Ms. Johnson, thank you for that question. And I think it is an important question because ultimately our goal is that the residents of Ward 7 and 8 have access to the health care faculty and staff that's necessary to provide the necessary care. So our goal is through our partnership with the GW School of Medicine and the faculty practice plan is that there will be attending physicians on site at the St. Elizabeth's campus, meaning that if you have the need for a primary attending, that primary care attending will be available to you on site at the St. Elizabeth's campus. I think it's a very important question also as you look at the specialty services. So any specialty service that you may need for continuity of care or for prevention and wellness will be available on that campus if so desired.
Thank you for that response, Kim. We'll go next to Nyla Roy in Ward 7. Nyla, your line is unmuted.
Hi, good evening, everybody. My name is Nyla, Ward 7. I am an undergraduate student at Howard University, and I also work at a Federal Health Qualified Health Center. And my question is, will there be birthing center? Are you all thinking about putting a birthing center in OB ward of the hospital? D.C. only has one birthing center in D.C., and that's Ward 7, so I think it would be really great and ideal for patients to have a birthing center and have access to that. Thank you.
Thank you for that question. We're excited about the maternal services that will be coming back to the community with the development of this project. And so there will be newborn delivery services, maternal services, an OB unit there, as well as the neonatal intensive care unit, which will be in a children's emergency department, by the way. And I want to just make that point, that there's another partner in this process, and that's Children's National, who will be the provider for emergency services for children. But yes, maternal services, newborn services, and obstetrics will be at this facility.
Sorry about that, I was muted. We'll go next to Belinda Milner in Ward 7. Belinda, your line is unmuted.
Hello. Hi. My question is, will there be a percentage of residents of the District of Columbia that will be hired for some of the positions that will be available?
Thank you for that question, Belinda. The projects have both a CBE requirement, which means 35% of the work has to be done by certified businesses in the district. So on the construction side and the operational side, there'll be participation for district residents. It also has a first source requirement, which requires that 51% of the jobs be available and go to district residents. So we expect to have a very robust workforce development program leading up to the opening of the hospital and the ambulatory pavilion to ensure that there's maximum participation for employment opportunities for district residents for the operations of the hospital. Also, not to be ignored, for the construction of the hospital, we expect those district residents to have opportunities there because our first source law, which requires district resident participation in jobs, applies to both the construction as well as the operations.
Thank you, City Administrator. And we have time for just a few more questions. We're going to go next to Rick Bardick in Ward 6. Rick, your line is unmuted.
Good afternoon. My question is that will the new Howard Hospital, specifically where will it be built, and will the current hospital remain in operation until the new hospital begins operation? Thank you.
Thank you for that question. We're going to go to Wayne Frederick for the response there. Wayne, go ahead.
Yeah, sure. The new Howard Hospital will be built on the lower part of the campus in an area that is currently in the middle of all of the health sciences schools. And the old hospital will remain in operation until the new hospital is built.
Thank you, Dr. Frederick. We'll go next to Mark Miller in Ward 3. Mark, your line is unmuted.
Thank you. This is Mark Miller. I'm in Ward 3, and I'm the District Long-Term Care Ombudsman. First, I just want to thank Mayor Bowser for your efforts to bring quality acute care services to district residents through these new facilities that'll be built that I realize will replace UMC. So my question is, what are the plans, if any, for the current 120-bed skilled nursing facility that's on the UMC campus? Will that be replaced?
Thank you for that question. And so we are in discussions around how that SNF will be replaced. We're talking to providers in the market now to continue the operations or absorb the operation of the long-term care facility that's in the existing UMC as a part of a bigger operation. And so the Deputy Mayor for Health and Human Services, Wayne Turnage, in his office has been leading that discussion to ensure that the SNF remains viable and, frankly, even more viable than it is today.
All right, I think that's it for our questions for this evening. So again, we want to thank you all for joining us, and we're going to pass it back to Mayor Bowser if she has any closing remarks. Go ahead, Mayor Bowser.
Well, thank you, Tomas, and I want to thank all of the panel for participating today. City Administrator Young, I want to thank you and your entire team, Deputy Mayor Turnage, Dr. LaQuandra Nesbitt, and our entire D.C. government team who has worked with our partners. We did set out the goal to find partners to help us run a medical center and get the district out of the business of running hospitals. And I think that we have struck the partnership that is going to work well for the provision of services to Washingtonians. We know about how systemic racism and the uneven distribution of acute care facilities have led to huge disparities in health outcomes in our city. And while, as Dr. Frederick mentioned, it is important to have state-of-the-art acute care facilities, all of the health care that would help prevent people from getting to the hospital is also important, from making sure we have access to doctors and specialty care and ambulatory care are all going to benefit D.C. residents. We're very excited, too, about the investments that we will make with Howard University for 5 centers of excellence that will help us take advantage of the academic expertise of Howard University, and they'll have a synergy as well with all the work that DC Health has done on our strategic plan for a healthy Washington, D.C. So this is part of a major plan to improve the health of Washingtonians. And we know, and we see very clearly what COVID has exposed. And that is for people to really fulfill their great life in Washington, D.C., to have a fair shot that this city can provide. You have to have your health. And so I'm looking forward to working with the council, our request to them, and I appreciate Councilmember Gray and Councilmember McDuffie holding a joint hearing on June the 30th so that we can advance these proposals together, and we will continue to ask the council to vote on this before they go on recess this summer. So you continue to ask us questions. We're all ears, and we look forward to getting this delivered for the people of Washington, D.C. Thank you, everybody.